All right, guys, let's talk about behavior. And we're going to focus mostly in on two types of maladaptive behaviors, things that are not good, which is addiction and violence here. So, guys, behavior is the way in which one acts or conducts one's self. Maladaptive behaviors stop an individual from adapting to new or difficult circumstances. It means they cannot adapt and have like a healthy type of outlook there. It can begin after a major life change, illness, or traumatic event. Now, a big thing here is we need to ID these maladaptive behaviors, and we need to try to replace them with more productive ones that are safer for the individual and also healthier for the individual. So one of the first ones we want to talk about in these maladaptive behaviors is addiction. Addiction is a compulsion, abnormal dependence on a substance or on a behavior. Now, when we look at addictions, guys, addictions are going to revolve around maybe substances like alcohol, cocaine, opiates, tobacco. Behaviors could be things like gambling, the internet, pornography. Okay, so something behavior-wise that they are dependent on, and it's an abnormal dependence. Anytime we look at an addiction, it has adverse physiological, physical, economic, social, or even legal ramifications. There are going to be consequences to a type of addiction. Now, there's some different kind of terms we need to look at here with addiction. We have substance-induced disorders. Substance-induced disorders are direct effects of a substance that has been consumed. Now, substance use disorders are then the cognitive, behavioral, and psychological symptoms associated with long-term use of a substance. Okay. Intoxication is going to be described as a described behavior and or physical symptoms that result from that substance use. Okay, so if you're intoxicated, it's how you're acting or what's happening in your body due to that substance. Craving is a desire to use a substance, okay, or to perform that behavior. Okay, so it's a craving. Tolerance is an increased need for the substance in order to achieve the award. A lot of times tolerance happens where this was the level of the drug you had to take to get that reward feeling. After tolerance, it has to go to this level, and then you tolerate that, and then you go to the next level. It's a constant increase and to get that same feeling that you wanted from that first time use, that reward feeling. Withdrawal, guys, is the syndrome of symptoms that is caused from a sudden cessation of taking the substance. So the patient or individual go through withdrawal if they, for some reason, stop taking that substance very abruptly. Okay, and this can be very severe physically and mentally. So types of addiction. So the first one we have here is the substance-induced disorders. This is where the substance affects the central nervous system, causing a physiological, psychological, and or behavior effect. Now, with this, symptoms of intoxication and withdrawal are specific to the substance that's being taken, whether it's cocaine, tobacco, whatever that might be. Now, a patient with substance-induced disorders often deal with other things like depression, anxiety, or even psychosis. Symptoms with substance-induced disorders are fatigue, insomnia, headaches, seizure disorders, changes in mood, anorexia. Okay. Also, we see vague physical complaints, overabundant use of mouthwash or toiletries, appearing older or unkept in their appearance, leisure activities that would revolve around the alcohol or drug or substance that they are craving. Now, guys, there are consequences when we look at this. These consequences and these symptoms will progress if you go into substance use disorders. This is continuate, frequent use of the substance. This does occur over time, and it is a cumulative thing. So these symptoms start to add up the more the individual uses the substance. This can go from mild to severe, and it is based on how different criteria about what's used here. Now, again, there's consequences, whether it's substance-induced or substance use. Something can happen that's called habituation. And we'll talk a little bit more about these consequences in a minute. Now, behavior addictions are behaviors that produce a reward response. And we see it could be an impulse control disorder, actually. Okay, behavior addictions are kind of weird because they could fall into multiple categories, but it still has this reward mentally and in the central nervous system when they perform those tasks. It's not due to a drug, but it's the feeling they get when they gamble and win. It's the feeling they get when they are watching that pornography or whatever it might be. It's that reward that they feel is there. And so it is very similar when we talk about it compared to even substance abuse. So some consequences. A consequence when we talk about this whole idea of addiction is habituation. Habituation is when neurons that receive repetitive stimulus will chemically inhibit their own receptors. This is to restrict their stimuli. It's kind of like when you get overstimulated and you remove yourself from the area to where it's a quieter place. This is what the neuron's doing. So instead of having 10 receptors because they're being overstimulated, they will actually use chemicals and remove some to where they only have a few receptors. Okay, a lot of times we call this downregulation as well. This does happen naturally. It is part of evolution in the sense that when a famine is going on, it allows an individual to tolerate hunger a little better. Also, individuals who live in the city, they learn to be able or become habituated to sleeping where they hear loud noises. They don't pay attention to them. It's just something that's second nature. And so it is something that our body does utilize naturally. And this is just exploited though here in a negative way. Adaptation, though, is taking it a step further. This is where there's a permanent restriction in the receptors. It's going to establish a new type of equilibrium. So if equilibrium was 10, okay, we did habituation that brought it down to 5, and adaptation says, hey, our new equilibrium or our new normal is 5. Okay, this is going to cause long-term effects. Okay, so long-term stimulus, long-term effects. Increase in the stimulus has to happen in order for them to regain that high, that feeling of normal or euphoria that they're looking for. Okay, so it requires then for them to take more of those drugs. And this again brings us to the whole idea of tolerance. And then, of course, there's the consequence of withdrawal. Withdrawal is going to have not only a psychological and mental side that's going to be affected, but there's going to be physiological changes that are going to occur if a patient goes through actual withdrawal. All right, so risk factors for addiction. It could be a family history. Of course, if you have a family history of addicts or you even live with an addict, it might be something that influences you. Burnout. When we talk about burnout in certain kind of activities or jobs, mood disorders, stress, homelessness, early aggressive behavior could be a risk factor for addiction. Lack of parental supervision. Just the fact that drugs are available to you could promote addiction, as well as poverty. So these are all types of risk factors that make a person more prone or more susceptible to addiction. So assessment. How do we assess addiction? Well, we need to take a history. When we take a history, this is going to be looking, of course, at the medical history, family history, but we may also have to look at some of their behavioral history. This could include, like, do they deal with sexual dysfunction, trauma? How have they been coming in before for trauma due to falls or lack of balance or accidents that have happened? DWIs. Do they have any DWIs? Okay, failure to tolerate just normal doses of medication. If you gave them the normal dose, that would normally cause decreased pain in a patient, but they don't. They tolerate it and they need more. That could be an indication. Financial problems, frequent reference to a substance. They talk about that substance over and over again. And then also problems in areas of their just life function. If you notice that their grooming or their hygiene or different things are not kept up, there could be an issue. So guys, it's also important to ID tolerance and withdrawal. Okay, this is going to be where you ID whether they can have tolerance to certain drugs or if they're dealing with withdrawal type symptoms. This is where we might look at stress reaction symptoms. These are mediated by the autonomic nervous system. They result from stress by stopping the addictive behavior. This can range from mild, where they have uneasiness and irritability, to extreme agitation, rapid pulse rate, tremors, and it could even trigger trigger them to go into like a panic type attack. Another thing that we can look for when we look at tolerance and withdrawal is rebound symptoms. If an addictive substance is stimulating, it causes a type of stimulating effect, we might see that they would have more of a sedative type of effect if they're not taking that. On the other hand, if it has more of a sedative effect, we see that they could have a very stimulating or agitated type of behavior. So rebound symptoms may need to be observed. Another thing is denial. Individuals who deal with addictions, they like to deny it. And this deception is not just for others, it's also a denial for themselves. They don't want to believe it themselves that they have this addiction. They want to hide the problem. And when they try to hide the problem, it causes them to be dishonest. It causes them to maybe engage in criminal activity in order to pay or be a part of that particular addiction. We see that it can push family and friends away. And so this is going to be one of those things that we might end up seeing in a patient. We also would do a physical exam. In a physical exam, a lot of times if an individual has long-term drug use or alcohol use, we would see that they have liver damage. Liver damage will cause the patient to have jaundice, fatigue, and abdominal discomfort. We also see that it could cause damage when we have a lot of use of, say, IV type of medications or drug use that goes through the veins. You could have damaged veins or tracts available that could be seen in a physical exam. They may have decreased appetite, anxiety, palpitations with their heart, shakiness, increased heart rate, and then even sweating, diaphoresis. And then, of course, blood and urine tests can give us a lot of information about what's going on. These could be used for drug tests, also to look at intoxication, what levels they are able to be even tolerate in their body. These are really good diagnostic type of tools. Primary would be making sure that the community they live in is healthy. Healthy family units are also beneficial in help preventing addictions. With individuals, though, they could also really strive to develop and be educated to develop good coping strategies, positive coping strategies, instead of running to these negative ones. Secondary could be drug testing. Sometimes just the fact that a job or something does drug testing could help deter with screening and catch things earlier. Also, questionnaires could help ID certain addictive behaviors or personalities, which could help maybe with screening. Emergency management is a big deal, guys. This is to prevent life-threatening complications. Things like overdose, acute alcohol withdrawal syndrome. Now, acute alcohol withdrawal syndrome happens a lot of times when an individual gets hospitalized. They go from drinking so much daily, and then once they're hospitalized, they don't get it at all. So it causes that withdrawal syndrome to happen super fast, okay, instead of being more gradual in the process. Now, substance abuse recovery. Guys, recovery is when an individual who is sober from an addiction and getting help needed to maintain that sobriety. This could be due to helping with coping strategies, recognizing that craving is part of the relapse process, so not giving in to those cravings. The struggle is an everyday struggle, though, guys. It's not something they're going to ever get over. And so this is why a support system is super important, okay, when we're talking about substance abuse recovery. Also, we could have motivational interviewing that could take place. This is where you go in and you ask specific questions to help motivate the patient in order to want to seek that recovery, to seek out these types of management to help them overcome that addiction. And again, there could be some medications. When we look at medications, this is normally for relapse prevention. It might be ways to cause the withdrawal process to be a little less severe. This would be things like methadone that they give sometimes for if you are a meth addict. Also, the nicotine you get in the gum or the patch would do the same kind of thing. You're taking it down little by little to help with that addiction. All right, so now let's switch gears real quick and talk a little bit about violence. Violence, guys, is an intentional use of physical force or power, whether it's threatened or actual, against oneself, another person, or against a group or community. All right, so this could be self-inflicted violence, violence on another person, what we call interpersonal violence, or against a whole entire group. With violence, it does result a lot of times in injury. It could result in death, Psychological harm, maldevelopment, it could cause decreased or delayed development, and even deprivation. So the types of violence are self-directed, collective, or interpersonal. And within each of these groups, it could be a physical self-directed violence, it could be a psychological, sexual, or even neglect in each of these cases. Okay, so the type of violence or the type of harm may be different from case to case. So types of violence. We first see child abuse or child neglect. This is going to be where there's a maltreatment, whether it's physical abuse, sexual abuse, or neglect that happens to children. It results sometimes in the death of the child due to the abuse or the neglect, serious physical injury, or even exploitation when we talk about the whole idea of child sex slaves. Okay, so it exploits the children in that process. We also have elderly abuse. This can also be physical abuse, emotional, sexual, or exploitation. But neglect and abandonment can also be a big issue when we talk about children or elderly abuse as well. Okay, where those individuals are abandoned. When we talk about youth violence, this is the third leading cause of death for young people, especially between the ages of 15 and 24. This is where youth wants to hurt their peers. Now, this could be through fighting, bullying, threats with weapons, gang-related type violence. Hey, youth violence is going to revolve around youth hurting other youth. Hey, whether it's going to be verbally, emotionally, physically, that sort of thing. Bullying is a more specific type here. It's more prevalent form of violence, and it's going to be found in kind of all aspects. We do see it a lot, though, in teenagers and kids, but it can also happen like in the workplace. It's unwanted aggressive behavior among school-age children or other individuals that involve a real or perceived power imbalance. So in order for bullying to take place, there has to be a real or perceived imbalance in power between the two individuals, where one feels like they're higher or greater than the other, so bullying can persist. An issue with bullying, though, is it something that repeats consistently or constantly. This could be where they make threats to each other. They could be spreading rumors, attention, or attacking them physically or verbally, or even just excluding someone on a regular basis. All of those would be categorized as types of bullying. Now, of course, adults should be able to handle, and I'm not saying like be okay with bullying, but we should have some more coping strategies that help us deal with that versus children and even adolescents. Sexual violence, guys, refers to crimes like rape, sexual assault, and sexual abuse. All right, so just because somebody's been sexually assaulted, they may not have been raped. All right, so there's some different categories that are here. But again, this is going to be some sort of harm in a sexual type manner. Now, what are the consequences of violence? Well, there could be physical consequences. This could be just plain traumatic trauma. It could be mild like bruises or severe like broken bones or traumatic brain injuries. We also see that pain becomes a big issue with this. Also gynecologic injuries, dealing if it was sexual assault, pregnancy, and even complications that deal with that. Also, sexually transmitted infections could be a physical consequence. Another thing we can see is the mental health. In the mental health, guys, this could cause PTSD. This is this whole idea of re-experiencing the issue over and over again, avoidance and numbing, trying to stay away from things that potentially could trigger, and also increased arousal. Now, guys, increased arousal does not mean sexual here. It means that they will have insomnia where they cannot go to sleep, difficulty focusing, and they'll have what we call this hypervigilance where they're on the lookout for anything that could be harmful. Another type of mental health issue or consequence that comes along with violence is depression. And then there also could be decreased developmental or increased developmental delays. Okay, especially if a child is being abused early on, we could see that they're not meeting those developmental milestones like they're supposed to. Now, risk factors of violence. We see infants and children tend to deal with violence, and a lot of times this has to do with the size difference and that whole idea of a power struggle that takes place. Whether it's an older child against a younger child or an adult against a child. Okay, there's this kind of power struggle that comes into play mentally in their mind that causes that to be an issue. Older adults, we see that a lot of times the abuse comes because people feel that they're a burden. The older adult's a burden to them and they don't want to deal with that, so they neglect them or they abuse them in some way. Substance use also increase your risk, okay, because a lot of times they don't have full control of their cognition and their behavior if they're doing substance abuse, and so violence could be a byproduct. Certain mental health conditions can also increase the risk of violence, like depression, personality disorders, schizophrenia, mania, alcohol abuse, those sort of things. There could also be exposure to violence in childhood could make you have a higher risk. It doesn't guarantee that you'll deal with violence or that you'll continue to be a victim to violence, but it does mean that that exposure causes you to be more prone to either commit violent acts or to also be a victim of violence. Socio-culture factors are also another thing. In society and even certain groups, it's cultural acceptance for certain types of violence, especially if it's within a family with a child and a parent. They may look at it as that's just the parent's right as a parent to discipline their children. Hey, there are some kind of fine lines with some of this, but this is where culture tries to accept this. In some cultures, it's okay for men to beat women, especially if they think that they have cheated on them or there is some other issue that's present. Again, though, this is not okay, and it does potentially put some groups at a higher risk. So what do we do with assessment and management? Well, for assessment, we're going to look at the history. Again, detailed history is key. But a lot of times, guys, people are fearful to talk about the violence, especially if they're the victim, and especially if the one that is causing that violence or that abuse is present when they are being asked these questions. So it is good to build a good rapport, ask a lot of questions, but also give them a chance to come to you in a more private or not really secret, but a more comfortable setting. We also see examination findings. We can maybe find that there were old injuries as well as new injuries, things that may have healed without medical attention. Okay, big versus small issues. Not your typical type of injuries you would see. Like if they said, oh yeah, I fell off a bike, but that injury doesn't line up. Or I fell down the stairs and that injury doesn't line up. It could be a red flag that something is going on. Now, guys, when we look at management, the primary management is to try to stop youth violence before it starts. This is creating a safe place. A lot of times schools are that place where they can come and they have this safety place where this abuse hopefully is not happening. Bullying's not happening. We know, though, that this is not always the case. But if we can create a safe space and we can teach, like within family units, being healthy and all of that, it could help decrease the levels of violence. Secondary is to ID those experiencing violence. Okay, giving counseling, giving them a chance to be able to speak up. Now, guys, what is key about this, though, is if a child talks to you about sexual abuse, talks to you about any kind of violence against them, it is your job now to report that and to report that to the proper authorities. All right. That is them putting their kind of life and trust in you. But you need to also let them know that, hey, when you let me know this stuff, I'm going to have to report it. I'm going to have to say something about it. Okay. And sometimes they're actually relieved and glad. Other times when you have to say that up front, they may kind of pull back and not actually be so forthright. But again, building that rapport is super important to try to get individuals to open up and tell you about issues they may be dealing with. All right, so this finishes up some of this idea of behaviors with addiction and violence. If you have any questions, please let me know.